Hi, this is Dr. Nick. I'm the Incrementalist, and I'm here with better concepts for a healthier business and life.
And I'm Fred Goldstein with Accountable Health, working on healthcare system redesign and looking for new ideas and opportunities for the healthcare system to function better. So Nick, let's start today. It's been another week since we last discussed COVID. Been a huge amount of change, obviously. We'll see how much we can get in this presentation. Why don't you tell us what's going on?
Well, I think there's increasing availability of testing. Let's just cover that off for the first instance. So testing is not 100%. I think this is important to understand. So even if you get tested and it shows negative, that doesn't mean to say that you're negative. And we're really driven by clinical indicators. Unfortunately, there's PCR testing that most people are familiar with, where you take a swab from the back of the throat, has a 60 to 80% accuracy rate. So that could mean, 20 or 40% of people that are tested that are actually positive are not being marked as positive. So we have to be cautious about that. Good news, there's some development of some downstream testing, which is a blood test to determine if you've actually been infected and have recovered. This is great news because now we can identify people that have had the disease, have recovered from it, and are based on everything that we know, and this is not certain, as with so many other things, means that they are resistant to the disease, so they could be on the front line of treating patients that have COVID-19 and have their own natural immunity. So that's good news. As far as the treatment, I think we're hearing these signals of, some good signs. Let's just put a little bit of caution on that. These good signs are the rate is not increasing quite as fast as it has. So for sure, we're going to see more. This is going to be a rough week. I think we've heard that from a number of other folks. Everything that we can do is going to have the impact. So encouraging your employees to stay at home. That does not mean going out. That does not mean going shopping if you don't have to. That does not mean doing non-essential items. Go out and have some exercise, but do so on your own or, in a small group setting, but distanced appropriately, I think is critical. This is a tough time. Being at home, I think everybody's starting to get stir crazy. So the other thing I would suggest is, from a mental health standpoint, find some distractions and do some other things. Just from, if all you're doing is Zoom meetings, you're going to drive yourself nuts. So do something else. Go build something, pick up an old hobby that you had, paint something, go out. For me, it's gardening. I have to be honest, I dislike gardening. I really like it now, as long as it's not raining. That's essentially my rule. If it's raining, I'm not going out, but find something else to do. So some good news, but caution at this point, and keep focusing on those things.
Could you, before we move on, could you touch on the new mask recommendation?
Yeah, so that's a good point. I'm glad you bring that up. So I think you've certainly heard me talk about masks not being essential or not being important. I think there's a clear mandate across the board to say that masks are relevant. They prevent the spread of disease, and they also prevent you from potentially catching it, especially when you consider the droplet. So we talk about this airborne. Airborne covers two essentially distinct criteria. One is the individual virus particle, which doesn't survive very well, but can be transmitted. The other, more importantly, is it's on the droplets when we sneeze. You only have to sneeze into the sunlight to see how far your sneeze goes, or look at the videos online. That mask can prevent you from spreading it, but that also has the potential to reduce the intake of those droplets. It won't preclude the virus particles because they're too small when we get into the details of the mask. And quite frankly, as I said in one of my videos a while back, actually having something to protect your mouth is a good indicator to remind you to say, don't bring your hands up to your mouth, because that's the major means of transmission from an infected surface. So wearing a mask whilst you're out, absolutely guidance. I think that's safe and appropriate to do. But importantly, make sure you don't go and buy them all up. This is not toilet paper, folks. Don't buy up the store. Just buy what you need and use it for going out. I implore you, our frontline staff need these tools. don't make them put their lives at risk unnecessarily. Now, Fred, how about the world of healthcare and, the way that we deliver healthcare? I'm thinking about this. It's got to change.
It does. Obviously everyone's talking telemedicine and telehealth, and we got to roll these things out. And I think we're finally going to see that shift. The question is how broadly we can take it. What percentage of a primary care practice or other practices could potentially be done via telehealth, which would result in actually quite a bit of savings in costs in the system. If you think about it, you don't need a waiting room. You don't need an MA to walk somebody back. You don't need to clean that room. You don't need to make sure you wash your hands. There are all those activities that go on. And at the same time, you also have the situation of, keeping the people safer. So reducing the risk of infection. What I'm looking for also are broader ideas. So one that I saw recently was this concept of a pediatric clinic creating a fracture clinic for children. And they said, we can handle this all in a safe environment outside the clinic, freestanding. And children who have fractures, they're out and about. I'm seeing with a few times I go out, or there's somebody skateboarding in their driveway. They've got to get out too, and their health's important, and their mental health's important. And so they created this fracture clinic. So you keep somebody out of the emergency room, which we're trying to do anyhow.
Right.
Lower that volume. You reduce the stress and anxiety to the parents who are thinking, I've got to take them to the emergency room. There's coronavirus there. You're reducing that risk, and you're then giving them the opportunity to get everything done in a new way at this outpatient site. And in the cases where it's appropriate, they put the cast on right there and the child goes home. So it's really an innovative way that can probably continue after the fact, after we get through this COVID-19 situation and have a new way to deliver care. It helps those clinics that previously may have seen some loss of business. And I'm now beginning to look at where other areas where something like that can be applicable. Are there some cardiac type services or others where somebody maybe was going someplace else and now you offer them in a new way, not necessarily a telehealth way, but those are the things I think that'll be interesting to watch over time. The other interesting one I'll just touch upon that I just found this morning is this whole approach in New York of the city level COVID-19 rapid response to serve at-risk populations. And this group has come together, the hospitals, the payers, the communities, and they put together a playbook that we'll make sure we get available, that we put out so people can see it. But essentially, it's a playbook for cities to begin to understand how to solve this crisis and focus on the most at-risk people. So there's a lot of innovation going on. We'll see where it gets to, but I think there's some really neat stuff happening, and hopefully we can highlight that in the coming weeks.
Yeah, so I think that's interesting. It's not just fractures. Obviously, health and health problems continue to occur, and people have to think about this new environment, and that's a really clever way of approaching this. And actually it has additional benefits, keeping people out of the ED.
Yes. Yeah. And I think you're seeing that. I talked to someone at the University of Mississippi Medical Center. They're trying to figure out how to do more diabetes prevention programs and care using their statewide telehealth system and get people in. So we're starting to see those innovations happen. It'll be fascinating to watch.
Fantastic. Well, as always, a delight to catch up. Important topics, obviously constantly changing. But it's great to sort of keep up with this and keep projecting out into the future. I'm Dr.
Absolutely.
Nick, I'm the Incrementalist, and I'm here with incremental steps to a healthier business and life.
And I'm Fred Goldstein with Accountable Health, and thank you so much for joining us this week.